So if this is a normal, this is a varus, genu varus. This is somebody, the cowboys, that ride the horses. Or you've got somebody who's bow-legged, yeah. Bow-legged folks can fly for some reason. I have no idea why.
That's me.
Everybody I've ever seen that's bow-legged can run fast. Why is that the case?
I don't know. It gotta be some kind of. That was my friend.
Like the way the ankle, the way their ankle to like push
I
off.
have no idea. But my college roommate, he looked like he just got off the horse.
There's no
So they're
friction.
taking steps that way
I think they
instead
just
of
run.
forward. Right.
Yeah.
That's amazing.
We talked about valgus, valve being wider at the bottom. We didn't see anything major there. Which one of these is going to have more medial knee pain?
Varus, yeah. Valgus.
Valgus. Valgus puts more medial stress. Knees tend to break down more medially with osteoarthritis. So if you see somebody that looks like this, come look at them when they're 60, 70, 80, it'll be even more pronounced. These people just tend to be tighter, I think, more than anything. That's my estimation. What do you think about that?
The bears.
Yeah, the people who are bow-legged, they're just tighter for the most part.
Yeah.
I'm good, man.
Which one of these are gonna have flatter feet? No arch.
Valgus.
Valgus. Valgus. Those knees get, those feet are flat and those knees just gonna dive right on in. Which one of these is gonna be more susceptible to the ACL problems and so forth? Valgus.
I'm chilling, man.
Just again, just characteristics to think about. Not always the case. All right, little surface anatomy. This is a good photo here. Because sometimes it's kind of hard to see when someone's especially got their knee bent where everything is. So the patella is going to sit right here. It's a little more extended here. The femur, we've got that medial femoral condyle here. The tibia. Joint line. Really important to be able to find that, okay? Because we're going to do measurements off of the joint line. So you got to be able to find it. Tibial tubercle or tuberosity, that's pretty easy. What's the condition that people have, especially youth, where that tibial tuberosity sticks out up to an inch?
We haven't gotten.
Haven't gotten to that one yet? Come on.
Osgood slaughter.
Osgood slaughters, yeah. That's where you get repeated stress on the tibial tubercle, and due to that repeated stress, it starts to build up bony tissue. Anybody have that when they were growing up? Pretty painful. You can also get it at the Achilles down here at the calcaneus. Seaver's disease for that.
Aren't boys, like males, more susceptible to the Osgood's?
Kind of jumper's knee that goes into more of that.
Josh's is like huge.
Yep, and really tender. When he was young, I promise you, it hurt.
I'm so cute.
So we've seen in people who don't have swelling in the knee, you'll see this indention on both sides of the patella, okay? Fluid will accumulate in here very easily. So if you can't see someone's patella, it's most likely that they've got swelling. Then the medial lateral facets there. Okay, you got a lateral fat pad, you've got infrapatellar fat pads, all kinds of stuff going on there. And that's all to do the arrangement with the bursa and so forth. Again, pretty easily seen patella, tibial tuberosity in the head of the fibula here. Again, there's a joint line. It's not like straight up and down here. It's going to be right along here. Because again, think about how big, and looking at him over there, look how big those femoral condyles are, okay? It doesn't just stop right here. And here is our representation of our MCL, Pes anserine, and that medial joint line. I think Pes anserine is usually 2 to 3 fingers widths below the joint line. Yeah, it says it right there, 3 fingers widths. Depends on how fat your fingers are. Gertie's tubercle is going to be the attachment for the, we're looking at a lateral knee here. What attaches at Gertie's tubercle?
Fibularis? Fibularis?
Negative.
Is that the LC? We just talked about.
Come on, what attaches laterally? Coming from the hip. IT band. IT band. Not that much. And there's our LCL. Again, easily palpated. Difficult to heal without surgical intervention. Osteokinematics are relatively simple with flexion and extension. Not much to that. Here's the little bit of external and internal rotation that can occur. And again, this shows it in a non-weight bearing situation. That really is insignificant. It's only going to really happen in a terminal knee extension, functionally. Anytime we really need to worry about it. Range of motion really can't be easier, folks. If you can find a greater trochanter, which is pretty damn easy, lateral femoral condyle, and a lateral malleolus, you can do goniometric measurements of the knee. There is flexion. Now, what's going to limit flexion?
The quad?
Quad?
Oh,
More
wait, no.
bulk in the hamstrings and the gastroc. Okay? So if you've got big hamstrings back here and a big gastroc here, you're not going to bend as far as everybody else. So it's going to be what we call soft tissue approximation, right? So we're going to have a softer infield there. How about extension? It's going to be pretty hard infield there, yeah. Relatively firm, I would say. You've got ways to measure flexibility of rectus femoris in prone or hamstrings in supine. And again, this is really difficult to measure this way. I like to tape measure. A whole lot easier there. If I'm worried about someone's hamstrings. So normal range of motion, knee flexion, 135, 140. We're going to have a couple people in here who bend a whole lot even further than that because they don't have as many muscles back there. Knee extension would be 0, but you'll see plenty of hyperextension in here. And again, that voluntary range of motion, the rotation, 30 to 45. I don't think it's that much. Let's see. I don't look like 45 degrees to me, but anyway, I've never really formally measured that. All right, let's go measure some range of motion. Let's see what we got. Flexion and extension. Are you going to need something to prop the heel up?